Chapter 7. Recovering your communication. Another cognitive function that can become impaired after a stroke is communication. Losing your ability to communicate your thoughts and ideas clearly can be absolutely devastating. The most important thing to remember is that speech is a skill, just like walking, that doesn't change who you are when it's gone. You are still an intelligent, unique person. Communication problems after a stroke are especially near and dear to our hearts. David couldn't speak at all after his stroke, and he was fortunate to have countless hours of speech therapy to help him recover. One of David's speech therapists was Dr. Jacqueline Hinckley, Associate Professor Emeritus of Speech-Language Pathology at the University of South Florida. Another influential person in David's life was the world-renowned speech-language pathologist Dr. Audrey Holland, an aphasia researcher, advocate, and the Regents Professor Emeritus of Speech, Language, and Hearing Sciences at the University of Arizona. They kindly share their expertise on communication disorders with you now. Question 41. What kinds of communication problems can happen after a stroke? Author's note. There are three main types of communication problems that can happen after damage to the brain. Two affect speech, and the other affects language. Speech is the sounds we produce to communicate, and language is the words we say. You may have one, two, or all three problems. Dysarthria is a type of communication problem that causes slurred speech. There are a few simple strategies to improve the clarity of your speech. Slow down, speak a bit louder, and over-articulate or exaggerate your mouth movements. A speech-language pathologist can recommend specific exercises based on your symptoms to help improve slurred speech. There's another kind of speech problem called apraxia. Apraxia makes it hard to coordinate or sequence the movements of the muscles in the mouth when speaking. Apraxia nearly always happens alongside aphasia, the main communication problem that affects language after a stroke. Aphasia affects about a third of all stroke survivors. Aphasia and apraxia are treated together to help stroke survivors communicate more effectively. Question 42. What is aphasia? Dr. Hinckley. Aphasia is the disruption of language after a stroke. When I say language, I mean understanding what people say to you and being able to say what you mean, as well as reading and writing. Try to imagine being in a country where people speak a different language. You don't understand it, can't speak it, and can't read it or write it either. You can look around and understand what's going on, but you have a barrier of communication. People with aphasia have that kind of problem. It may be that they can't say or understand anything, or it may be as if they know a little bit of the language, but not as much as they like. Unfortunately, many times in our society, we equate the ability to speak with intelligence. So people treat those with aphasia or other speech problems differently. People with aphasia still have their intelligence, but they're not able to convey it through the normal language channels. That's very difficult for people to understand. I've even heard people with aphasia say, "Gosh, I'm not smart anymore." That's simply not true. It may be hard to understand and to communicate, but aphasia affects only your command of language, not your intelligence. Question 43. Are all cases of aphasia the same, or are there different types of aphasia? Dr. Hinckley. There are many different types of aphasia with various names to reflect the different impairment profiles people can have. Some people with aphasia have much greater difficulty with understanding speech than others, or Wernicke's aphasia. Some have much greater difficulty saying what they want to say, or Broca's aphasia. And some people have difficulty with everything, or global aphasia. Similarly, there are differences for reading and writing abilities. These problems can be combined in different ways and to varying degrees, depending on which parts of the brain were affected by the stroke. Dr. Holland. I have never met two people whose aphasia is exactly alike. Aphasia doesn't involve just language. It also involves motivation, attitude, and energy. Those factors are not all the same for all people. When you've met one person with aphasia, you've met one person with aphasia. When you explain aphasia to others, you should be very specific to the particular needs of the person with aphasia. You can say he has trouble talking. He also has trouble understanding, particularly if you talk too fast or too much. He gets tired easily. He can read very well, but he can't write.
My aphasia was really, really bad. I could hardly speak at all in the first couple of years. When I was 12, I went to Dr. Hinckley, and she is an amazing speech-language pathologist. She taught me ways to communicate through means besides talking, and she engaged me in things I was interested in. So I wanted to communicate, and I made a lot of progress. Wherever you are with your speech, keep working on it, word by word, day by day. David.
A tip. Being interested in a topic improves attention span and can make a task enjoyable. Explore topics you like to keep yourself engaged in the recovery process. If you like football, read the sports section out loud or talk with a friend about last night's game. If you like art, go to a museum with someone and have a conversation about your favorite exhibit. Just because something is therapeutic doesn't mean you can't make it interesting. The recipe for a happy life is to fill it with pleasure, passion, and purpose. Question 44. What does recovery look like for someone with aphasia? Dr. Holland. You can expect to see the biggest gains within the first 2 or 3 months in the period of spontaneous recovery, but recovery can go on and on for many years following a stroke. It's important that people who've had a stroke and their families don't give up hope, and that they continue to be resilient and optimistic about the ultimate long-term recovery. I'm not willing to make a prediction about how much better someone with aphasia is going to get, but it is pretty clear that when you have aphasia, you're never going to be more aphasic than when you are the first day you have the disorder. There is certainly hope, and there is also help. Question 45. How can speech therapy help people with communication problems? Dr. Hinckley. Therapy should be oriented towards helping people get back to doing the activities that are most important to them. That is essential, not only because they want to get back to doing those things, but also because therapy can be most effective when it's embedded in what's motivating to stroke survivors. The way our brains change can be enhanced if we're doing things that are meaningful to us. We often hear, use it or lose it. Another principle of neuroplasticity is use it and improve it. If the therapy is very directly focused on what patients want to do, then they're going to keep doing it more throughout the day and across days. When they get more practice and repetition, they're likely to improve even more. Also, we have quite a number of therapy approaches that have been researched, so we know what the probable outcomes will be. If we use these evidence-based therapies, and they're matched properly to a person, then we can increase the likelihood that good improvement is going to be made. In addition, most of the research we have for the effectiveness of aphasia therapy is based on stroke survivors who are beyond the first 6 months of recovery, so we know people continue to improve with therapy. Question 46. How does group therapy compare to individual therapy? Dr. Hinckley. Group therapy has some very nice advantages. When you're in a group situation, you're practicing your social communication skills. You're trying to get your message across to people who may or may not understand it, so you have lots of opportunities to problem solve with support. In addition, the psychological and social support of being with people who are facing a similar circumstance is very encouraging. You might see someone else with aphasia using a communication strategy that you haven't tried before, and it might work for you. Individual therapy, since it's tailored specifically to you, gives you dedicated time to practice the specific skills you want to improve that are harder to work on in a group setting, like reading and writing. The best situation is to have a combination of both individual and group therapy.
I co-founded Aphasia Recovery Connection. We have a group on Facebook to connect people with aphasia. Not everyone has a stroke or aphasia center nearby. Our group is available 24/7 online, and it's filled with people who really understand what you're experiencing. Being surrounded by people going through the same thing can help you remember that you are not alone. David.
A tip. Watch out for terminal uniqueness, the belief that the situation you're in is unlike anything faced by anyone else. It affects stroke survivors and loved ones alike, and it leads to isolation, depression, and anxiety. Cure terminal uniqueness by putting yourself in situations where you're not the only one. Remember, there are millions of stroke survivors in this world. Go meet some of them. At Aphasia Recovery Connection, for example, you'll be surrounded by other survivors and family members. By hearing and relating to other people's shared experiences, feelings are normalized. This leads to connection, hope, and faith. Question 47. What can family members do to help loved ones with aphasia? Dr. Holland. The most important thing for family members is to learn to communicate with their loved ones with aphasia and to learn the techniques that are involved in what is called supported communication. This is where you change your own language style to make the person with aphasia better able to understand. By using paper, gestures, and specific questions, it's also easier for the person with aphasia to express him or herself. It's bigger than just using picture boards, though that helps some people. Supported communication is about changing your communication style to reveal the competence of the person with aphasia. For example, asking the person with aphasia to verify what he meant by something. Learning what his strongest communication modality is. It could be gesturing, writing, drawing, or speaking. Reminding him that he might try writing something, or giving him some written choices to pick from. It's really a strength-oriented approach, using what the person can do instead of focusing on what they can't. Also, it's important for families to understand fully that aphasia is a language disorder. It doesn't mean that cognitive abilities in general are affected. Knowing that the person's mind is all right may be the most important thing early on. Then the families have to understand that this is a long process and that recovery will go on. A lot of recovery comes from the brain settling down, so it isn't all related to therapy. It's also related to time. Families can also look for things that their loved ones are still able to do with or without language. Communication isn't all about just speech. It can be holding your hand as a way to say, "I love you." It can be things that are gestural or written. All modes of communication count. Communication tips for aphasia from Megan. Aphasia can be extremely frustrating, both for the stroke survivor and the communication partner. By making some adjustments in how you speak, you can help to ease that frustration. Here are a few small things that you can do that will make a big difference when talking to a person with aphasia. First, share the burden of communication, recognizing that it's not the problem only of the person with aphasia. Be patient and allow plenty of time for communication. Second, say, "I know you know," to acknowledge that the person with aphasia is intelligent with ideas he or she wants to express but can't. Third, speak in short, simple sentences with an expressive voice, but don't shout, talk down, or use baby talk. Think of talking to someone who doesn't speak English as a first language. Fourth, use writing, gestures, drawings, and body language to supplement verbal communication. Point to objects or use pictures. Keep paper and pen handy to write down key words. Fifth, ask yes or no questions, such as, "Do you want tea?" Include options in your questions, such as, "Do you want tea or coffee?" Or offer written choices, such as writing down tea, coffee, or juice, to make it easier for the person with aphasia to express an opinion. Sixth, ask questions one at a time, starting with general questions and then moving towards specifics. Is it about a person, for example? And then you could say, "Is it a family member?" When they say yes, you could say, "Is it Karen?" Keep in mind that a yes-no response may not be completely reliable, so it's okay to go back and double-check. Seventh, eliminate distractions and background noise, speaking in a quiet environment. One-on-one interaction is usually better than a large group. Eighth, Repeat what you think you understood to make sure it's correct. Don't pretend you understand if you don't. Ninth, ask the person if he wants you to answer for him or fill in the words when he's struggling. Some people appreciate the help, while others would rather speak for themselves. Remember that it's okay to give up if things get too frustrating. You can agree to come back to an idea later when it might come out more easily. Dr. Hinckley, we need to be patient. Those of us who do not have aphasia are used to taking turns in conversation in 1 second or less. But when you have aphasia, it's not uncommon to need 10 or 20 seconds to get going on the message. That's 10 or 20 times longer than we're all used to waiting. That's very hard for people to do. I'll ask caregivers to count just 3 to 5 seconds after they finish speaking before speaking again. For some people, even waiting that long seems like an eternity. It's very hard for them to wait, but they need to practice it to give the person time. Many people are not comfortable with silence. There is a lot of silence with aphasia, so we need to do things to help ourselves be comfortable with silence, to feel that it's okay and not a bad thing. Mindfulness or meditation may be a way to help with this. Sometimes people with aphasia get tired. They're working so hard with all these words that are coming at them or that they're trying to say. It's important to have these quiet times. You can sit quietly on a park bench and look at the beauty of nature and just share the space in silence. Those things are very important too.
A caregiver asks, if you can tell when a person with aphasia wants to say something and you think you know what the person wants to say, should you help the person with the words?
Dr. Holland, I don't have the answer to that. That answer lies with the person with aphasia. What works for one person will not work for somebody else. When a family member says, "What should I do? I don't know if I should give him the word or not," I always say, "I'm not the one to ask. Ask him what he wants you to do, and he'll tell you either leave me alone, I want to struggle with it, or I could use the help." The person with aphasia should be given every opportunity to feel his own strength and to be empowered. There are 3 sources of expertise, sort of like a 3-legged stool. There are the academics or clinicians who have studied aphasia and work with it. There are the family members who live with the people and know them well. And, most important, there's the people with aphasia themselves, the true experts in what they need because they live it. You need all 3 legs for the stool to stand. Dr. Hinckley, family members face a high wire act in terms of balancing their desire and need to help with encouraging independence. That's not easy. The thing is to talk about it and work with the person with aphasia to find the right balance, not just decide unilaterally what you think should be done, because the person with aphasia probably has his own opinion too, and it should be taken into account. Question 48. What can people with aphasia do to improve their communication at home? Dr. Holland, they can do things daily that get them communicating with others. Therapy doesn't happen just in a room with a professional, but every day out in the world. The famous psychiatrist Fritz Perls said, "The end of therapy is when everything becomes therapeutic." Another important thing is to get the person with aphasia involved with other people who have aphasia, and to do this early on. It's a terrific support to surround yourself with other people with aphasia because they understand what it's like. They are people who live with the problem and they are incredibly helpful to each other. Getting involved with an aphasia community is one of the most potent, long-term treatments for aphasia that we have. Dr. Hinckley, yes, it's very important for the person with aphasia to seek out aphasia or stroke support groups. The National Aphasia Association lists programs by region so people can find a place where they can go to get support, even though it's not formal therapy. That support is more than just social support, although that's critical too. It also means you're getting out of the house, you're being active, and you're getting back to doing activities. All of that is very important to continue improving. As I've mentioned before, an important principle of changing and improving your brain is use it or lose it. So it's very important to stay active and engaged. I have always told my patients that there is one guaranteed way to stop making progress if you have aphasia after a stroke. Sit on the couch, watch TV, and don't do anything else. If that's your day, then you probably will stop improving because you're not engaging your brain and using your communication skills in any meaningful way. So the first thing is to stay active, but that's probably more easily said than done after a stroke. I would suggest people find something that they can do, something accessible to them and something very important to them, and just start doing it. Get out into the community. Finding an aphasia group or finding friends, neighbors, and family members who can help get you out so you can continue doing things is probably the most important step. In ideal circumstances, a speech-language pathologist will set up some kind of exercise program that you will be able to continue to do at home. Technology provides us with a lot of different options as there are now so many apps and practice programs available. Ideally, the speech-language pathologist will help you find the app or software that's going to be a good fit for you and help you set it up. Question 49. How can technology help people with aphasia? Dr. Hinckley, just in the last few years, we've had an explosion of apps and technology available for aphasia. There are some tools that are designed for people to create or use stored messages so that when they go out into the community, to order at a restaurant, for example, they can communicate better. Apps that do that are probably my favorites because they are combining the smarts of the technology with the support of helping the person get out into the community and actually interact with others. There are many software programs and apps that are designed for drill work, such as practicing spelling or understanding words. These can help people practice specific skills, but they shouldn't be used to the exclusion of having conversations with family members or other people. That's a concern that we have to be aware of with technology, people being glued to their phones or sitting in front of a computer all day. Dr. Holland, technology is a booming industry, and it can offer so much for people with aphasia. It runs the gamut from speech-generating devices to teletherapy, which is working with a therapist via a video chat, to online support groups like Aphasia Recovery Connection. Choosing good apps and sticking with them is more important than downloading hundreds of apps. Once you find apps that you like, keep using them. And don't forget about the apps and features that are built right into your phone or device, like having texts read aloud or taking photos. Learning to use those is just as important as learning to use the apps specialized for aphasia. It's also okay to have apps for fun. I'm addicted to Words with Friends. It's a game like Scrabble that you can play at any level, and it's a language activity. Apps like that are just fun, and the importance of that shouldn't be discounted. Using technology to improve communication, from Megan. Technology can help stroke survivors with aphasia in 3 ways: to connect, to communicate, and to improve. Connect. Phones have always allowed us to talk to people far away, but with video chats through Skype, FaceTime, or Google, people with aphasia can communicate better by using gestures, writing, and facial expressions. Sending text messages and email allows people more time to compose their thoughts, look up their words, and respond. Social media keeps stroke survivors connected with family and friends far away and makes it easy to meet new people who understand strokes and aphasia. Joining an online support group like Aphasia Recovery Connection can lead to more communication opportunities. Communicate. Tools and strategies that supplement or replace verbal communication are called augmentative and alternative communication, or AAC. AAC can be low-tech, like a pad of paper or a picture communication book, or it can be high-tech, like an iPad. There are many AAC apps available to help people with aphasia to communicate. They're not a cure, but they can help if the app is carefully selected and customized and the person is trained. Lingraphica offers some free AAC apps as well as dedicated AAC devices for aphasia. The built-in camera, photos, maps, calendar, and notes apps can also be used for communication, along with whiteboard apps for quickly writing or drawing messages. Accessibility features like voice dictation and text-to-speech can also help with reading and writing. For more ideas on using the built-in apps on your phone, refer back to the Using Technology to Improve Cognition box. Improve. Using therapy apps and software can be a great way to increase the intensity of your practice. The research evidence shows us that computerized therapy can be very effective in helping people with aphasia improve, even years after a stroke. Keep recovery going by working on your own or with a partner at home. Look for apps designed specifically for adults with aphasia and based on therapy activities proven to work, like those by Tactus Therapy. Ask your speech-language pathologist to help you find the right activities to challenge you.
Our stroke survivor asks, does watching TV help with language improvements?
Dr. Hinckley, one way to think about this is to ask, if you watch TV in Spanish, will you learn Spanish? If all you do is watch a TV program, then the answer is probably no. But if watching a program is combined with talking about it or reading about it, then it can help as part of those larger activities. Simply sitting and watching TV is a very passive activity, and our brain needs to be active to improve, so it's not a very helpful activity on its own. Of course, we all have our favorite programs, and it's a good thing to watch a program that you enjoy. Try it with the closed captioning on to see if that's helpful. Many people with aphasia find that it helps, though others find it to be an unhelpful distraction. However, even with reading the captions, sitting at home and watching TV all day is still not a good idea. Question 50. Does a person with a communication problem have the right to make his or her own decisions? Dr. Hinckley, absolutely. The only time somebody does not make his own decisions is when he is legally deemed incompetent to make those decisions, and that usually has to do with not being able to think clearly or reason things out. Aphasia alone should not prevent somebody from being able to make his or her own decisions. However, it is going to mean that the person with aphasia may need some support to understand any legal or technical documents. If there are financial issues, the person might need a little help in understanding, but once he does, he has the right to make decisions about it. The Aphasia Institute has a series of booklets that have pictographs and simplified language to support people with aphasia when talking about different complex issues with social workers and others. That support can be very helpful. Takeaway points. Communication problems are common after a stroke. They can be problems with speech, like dysarthria or apraxia, or language, also known as aphasia. Aphasia is a language disorder that can impair speaking, understanding, reading, and writing in varying degrees in each person. It is not a problem with intelligence. Speech therapy can help people with aphasia to recover. Group therapy and individual therapy are both helpful, especially when evidence-based treatments are used. Family members can help best by learning to adapt their own communication styles to support the person with aphasia. Be patient. Allow the person more time to process and respond. Show respect for the person's intelligence, which might be hidden by his or her language problem. Enjoy each other in silence and find new ways to communicate. Ask the person with aphasia if he wants you to help or speak for him. He's the expert in what he needs or wants. Staying active and engaged in the community and in life is the best therapy. Don't sit at home watching TV all day. Join an aphasia group to get out of the house and meet others who understand. Use technology to help your recovery. Practicing exercises by using apps or software can intensify your rehab and help with neuroplasticity. Use communication apps to help when you're out in the community, and join an online support group like the Aphasia Recovery Connection to connect with others. People with aphasia still have the right to make their own decisions, but they may need extra support. Chapter 8.